It's okay sign, those are the ones you really have to pay attention to. Okay, the others, doesn't mean you don't have to know them, but you don't have to know them in as much detail. When we look at the nematodes, we have gastrointestinal nematodes. In large animals, you have to pay attention really closely to the trichostrongyles. There's lots of different kinds of that. And then the other one is Oxyurus equi. And then Trichinella spiralis. Those are the three big ones. The others, you gotta know what they are, know a little bit about them. Then when we get to the circulatory nematodes, the primary one is Strongylus vulgaris, okay? Ileophora is another one that you need to know a little bit about. Respiratory nematodes, Dictyocollis species is the one. When it talks optic nematodes, Phalasia, you need to know a little about it. But then when we get to the skin nematodes, you have to understand what Onchocercus cervicalis is. Staphylophalaria and Hadronema, know a little bit about those. So let's go over these. First, we're going to talk about the gastrointestinal nematodes. And these are primarily the trichostrongyles. Trichostrongyles live more commonly in the ruminants, cattle, sheep, and goats. And two of the species that's in trichostrongyles are really important. Enostemum and then Trichostrongylis. And again, there's different species in there. Then we have a few others, Shaburdia cooperi, and then Hemopus, Esophagostomen, and Ostratagia. The location for these things is going to be generally either in the abomasum or in the small and large intestine. Diagnosis, because they're GI nematodes, we're looking primarily for eggs. To find the eggs, we do a fecal flotation, and we look for those trichostrongyle type of eggs, okay? You could do a fecal culture and then let the larva hatch, and then you can identify the larva. But generally speaking, people are going to be looking for the eggs for these. Now, when it comes to the life cycle of trichostrongyles, eggs are obviously in the feces. They hatch, but they hatch outside in the environment. And they live free in the environment for a while. Once they mature to the third stage out in the environment, they become infective. And they crawl up onto the top of the grass. And guess what happens when they're on top of the grass? The cow eats them, or the sheep eats them, okay? Once they are inside the animal again, now they're going to mature. The interesting thing on these is that they are zoonotic, especially Enostemum and Trichostrongyles. If we get those things inside of us, we're going to get it, okay? The problems are variable depending on which species you get, but the other thing is how many of those worms are inside. Clinically, in cattle, we can see something called bottle jaw, and bottle jaw is right there. You get really edematous in the submandibular area. They can become very anemic. They can be weak. They can have really bad diarrhea. That's a typical appearance of a calf with trichostrongyles. Sometimes they get so bad that they may just die. What's really interesting about these is the subclinical aspects. Basically, they don't eat as much, so they don't gain weight. Okay? They don't reproduce very well if the mature ones have these trichostrongyles, and their milk production goes down. Not because it affects milk-producing glands or anything, it's just because of this. So what you see with trichostrongyles is this much. What you don't see is that much. And it can literally bring in or prevent you from making millions of dollars if you look at the entire industry. Now, large egg trichostrongyles is basically nematodiris. This is again cattle, sheep, and goats. location, again, abomasum in small intestines and large intestines. This is also diagnosed by fecal flotation. And now you get large strongyle eggs. They look very similar, smooth outer layer, and then on the inside it's either the morula stage or a single cell stage. So you can tell the difference between large strongyles and small strongyles. The problem with these is how many you got, how many of those large strongyles you get. If it's really low numbers, you're not going to see anything, okay? Some of it might be completely subclinical, and until you do a fecal, you'll never know it. If it becomes clinical, then what happens is the mucosa on the inside of the intestines starts to be disrupted. And that means now the mucosa can't absorb things across the mucosal surface. Protein starts to get lost because it's not being absorbed, so it's going to be lost in the fecal material. So they start getting diarrhea. If they're not absorbing the nutrients, they're going to lose weight. They have a tucked up abdomen because they're losing weight. They may have dull fleece coat if it's a sheep, and then if it's a really high infection rate, then they can die. The life cycle of the large strongyles is essentially the same as trichostrongyles. Now we get into whipworms, okay, or trichuris. Trichuris ovis is one of the primary ones, and just because it says ovis doesn't necessarily mean it's just sheep. It can get into goats and it can get into cattle as well. Whipworms live either in the cecum area or way back in the colon. And these whipworms, very similar to the small animal whipworms, the head portion kind of wraps around in the mucosa and then it penetrates. And it starts to take blood meals. In order to diagnose this, you got to do a fecal flotation. And you see the typical biopercolated egg. Okay? Problem with this is, again, they start losing blood. When they start losing blood, they get bloody scours. Scours is a word that they use in large animal, meaning diarrhea. Okay? They get very atrophy, they don't look good. If they don't look good and they don't have bloody scours, it might be because they have whipworms. And in order to find it, you got to do a fecal exam. This life cycle is direct. That means there's no intermediate host. So eggs are passed, and once they're passed, they become infected at the L1 stage. Really, really fast, they become infected. The egg is then going to be eaten. It's going to hatch in the small intestine, and then it's going to start all over again. Once it gets down into the cecum, large intestine, here we go again. Okay? Another one is equine pinworms. Equine pinworms is Oxyurus equi, and this lives in the cecum and colon and rectum area of the horse. Now, what's really interesting about this one is the female deposits the eggs outside of the body. They come out of the anus, they excrete their eggs, and they go back inside and leave the eggs on the outside of the anus. Okay? And that causes them to itch really bad in their butt area. And they start scratching themselves. They'll back up to a fence and they start scratching like crazy. And one of the first things you see in a horse that has Oxyurus equi or pinworms is the hairs on the tail end are all broken apart. And it looks really bad. That tells you that they're scratching. The way to identify these is you see the paritis and the tail hairs are broken. And then you have to identify the eggs. Well, the eggs are on the outside of the horse. So usually what we do is we take a piece of Scotch tape, we stick it on the butt of the horse, and we go put the Scotch tape on the slide and then look at the slide under a microscope. Okay? You could do it on fecal flotation. When you see whipworm eggs, they're very, very large as far as the embryo or the larva on the inside. Okay?
What's the paritis again? Is it scratching?
Paritis, right here.
Yeah, what does that mean?
It means it itches.
Itches.
So let's see if you can watch this actually happen. Here comes the female. Now she's depositing her eggs. You can see that little blob at the very end of the worm. And that little blob's getting bigger and bigger. And as it gets bigger, once she's done, she's going to go back inside. And that's going to leave these eggs right there on the outside. And that causes really bad pruritus. See how big that egg conglomeration is getting? Okay? That's how that happens. And so this is a typical appearance for a horse that has pinworms. Tail head hairs are broken and really unmanageable. And then you've got some alopecia down here where it's scratching its rear end on a fence or something. Another one is the pig roundworm. This is Ascaris suum. These live in the small intestine, and when they get really big infestations or infections of these kind of worms, it will actually block the intestinal tract, so nothing's getting through. Pigs that have Ascaris suum are usually very thrifty, kind of skinny. They just don't look good. Then the other thing that can happen because of their life cycle is they get a thing called thumps. Respiratory system, basically, when they have thumps on the inside, you'll see them expire real hard, but they'll push with their abdomen. So you'll see them start to expire, and then there's a big abdominal push. And that's what they call the thumps. Ascaris suum eggs are found on fecal flotation, and these are very, very resistant eggs. They'll live out in the environment for years. And then if another animal comes and picks it up, they're going to get pig roundworms. The life cycle for Ascaris suum is that the eggs are passed, they mature to the infective stage. That takes a couple, 3 weeks. Then the egg is ingested with the infective stage still inside the egg. Once it's been ingested, it hatches out. The pinworm larva then penetrates into the mucosa and gets into the bloodstream. Once into the bloodstream, it gets into different organs like the liver or the lungs. If it gets into the lungs, those larvae get out into the alveoli. They get coughed up and swallowed, and now they're back in the GI tract. Okay? The big concern about Ascaris suum is we can get them. Ascaris lumbricoides is the roundworm that is called, it's called in people, but when they start looking real close, they look like Ascaris suum. So that means if a human has roundworms, there's probably pigs around somewhere. Okay? And they got them from the pigs. The sources, they differ a little bit, but it's close enough, and there's enough circumstantial evidence to say, yeah, we can get it. Now, the next one is really an important one, and that's Trichinella spiralis. The primary host for Trichinella is the pig. That's the definitive host, but interestingly, the pig can also be the intermediate host, depending on where this organism lives. Aberrant hosts can be us or anything else. This is located generally in the small intestine if it's the definitive host. However, if it's an incidental or an intermediate host, those larvae can be inside the muscles. Okay? And you can actually see them encysted in the muscles. Okay? So that's the intermediate host. That means the definitive host has to eat the muscle. Okay? Well, when this gets infected, the animal itself may be asymptomatic, or if it's encysted in the muscles, it can cause a lot of muscle damage. The diagnosis is usually found by the eggs, if you can catch it at the right time. Maybe the larva, but generally speaking, what you're going to find is on a muscle biopsy, you're going to see this. Or you're going to get serology, run a serum test, and find out if they have trichinella. Basically what happens is these pigs eat garbage, especially uncooked garbage. The pig farm that's out by the dumps now used to be closer into town. Now it's out by the dumps. You know where they get the food for the pigs? The casinos. They have to cook all that food before it gets given to the pigs to hopefully prevent this so that they can kill trichinella. The life cycle, these things are viviparous. The females give birth to live offspring. The offspring penetrate the mucosa of the intestines, they get into the bloodstream. Once they're into the bloodstream, they can get anywhere they want to go. And then they can encyst in the muscle. And they can live for a long time now. If they're in the muscle and they die, they can start to calcify in the muscle. So you see little tiny white calcified larvae in the muscles of animals that are infected that way. If the muscle is eaten before it dies, then the larva gets into the epithelial cells, and then we start the cycle all over. And this is one of the things that people will cook, especially if they don't cook their meat. That could be pork or wild game. So that's why you never eat pork that's not well done. You have to cook that stuff. If you go out and go hunting and you shoot a bear and want to eat the bear, cook the meat. Okay? Otherwise, there's a good chance you're going to get trichinosis. Okay? All right. The next one is circulatory nematodes. One is called Endoparasites schneideri. The primary host for this is sheep. These things live inside the bloodstream, specifically in the common carotid artery. And they give rise to microfilaria. Have you ever heard of microfilaria before? Where? Heartworms. So now you got these little tiny baby worms floating around in the bloodstream. And when they get up into the capillaries of the head and the face, then they can start causing problems. And that one problem in sheep is called sore head. And that's usually because the carotid artery gets an obstruction, and then the smaller arteries downstream get an obstruction, and so the tissue dies. And so you end up with these sores on the head of the sheep. If I saw that, I would do a skin biopsy. I'd kind of macerate the tissue in some saline, and then look at it under a microscope. And then the other option is do a necropsy, and then look and see. You have to, on a dead animal, you cut into that area and start finding them. Now, the life cycle of this Endoparasites, the adults are in the carotid artery. They copulate, they produce microfilaria, and they get out into the capillaries of the head. Then the intermediate host comes around, and it's usually a horsefly. Horsefly bites, gets a blood meal. Now microfilaria is inside the horsefly. Inside the horsefly, it matures to an L3 stage. And this is usually found around the mouth parts of the horsefly. Horsefly then flies around, takes another blood meal from something, and then those larvae. You guys ever been bitten by a horsefly? Anybody ever seen one? These things are massive. And they have real big cutting plates. And when they bite you, it hurts. Okay, that's why you see horses run off real fast. But that means you've got an open wound, and now those microfilaria can get into your bloodstream. Okay, once in there, they start to develop. The adults end up in the carotid artery area again. It takes about 4 to 6 months from infection to the production of new offspring. That's what the prepatent period is. All right, the next one is the large strongyles. And large strongyles are primarily a big problem in horses. The definitive area where they live is the large intestines. But they can get out into the bloodstream, and they usually can get into the cranial mesenteric artery. Okay, so now it's in the arterial system. The cranial mesenteric artery is the primary artery to the small intestines. It comes off of the aorta. Then, once it's inside there, now we can start getting little areas of thrombosis to the intestine. And that causes pain, because now that one little area of the intestine starts to die because it doesn't have an arterial blood supply. And that's very, very painful. And that's why we end up with colic. This kind of colic, or acute abdominal pain, that's all colic means, is caused by these thrombi. Okay? Now, this is a real big problem in the horse because treating it is difficult. It usually leads to weight loss and poor appetite and lethargy. If you look at this piece of intestine here, see that black spot? That's because the blood supply to that area was cut off by one of those microfilaria that live in there. The diagnosis, again, because the adult lives in the large intestine, you do fecal flotations. And you look for the typical strongyle egg. If I'm lucky enough to have to go to surgery for colic, and you start seeing these things, there's really not an awful lot you can do, except maybe if it's really bad, resect a piece of the intestine and then suture it back together. That's not a real easy thing to do in a horse. Strongylus vulgaris starts in the large intestine, lays the eggs are passed out, they hatch out in the environment, and then they mature. Okay? And they're in the fecal material. Then these larvae actually can be seen inside a drop of water. That's a magnified drop of water. You can see the little worms inside there. That's the larva for Strongylus vulgaris. Horse comes along, eats some grass that has that on it, and now he's got it again. They get into the intestine, they mature, they go into the mucosa, get into the bloodstream, and then they can end up in the cranial mesenteric artery again. That's where they can mature to large form. Then they come back out of the bloodstream into the intestine, and they start producing eggs again. That whole thing takes about 6 to 7 months. Strongylus vulgaris is a really serious equine problem, especially if it causes the colic. Respiratory nematode starts with Dictyocolus onfili. Okay? This is located inside the lungs, especially the bronchi, and the smaller bronchioles coming off the bronchi. Horses get this a little bit more, but donkeys can get it as well. And it usually causes just a real persistent cough because now these things live inside the airways. If they get really bad infections, then it can cause airway obstruction. So one of the things you're going to see is the respiratory rate goes up because now they have to breathe faster and higher tidal volume to get air into their lungs. Diagnosis, again, is fecal flotation. You can find either the eggs or the larvae in them. The eggs, when they are embryonated, they're passed out, or they may actually hatch. You can actually see the larva in the fecal material. That then gets out and it becomes infected, and now it's in the grass. Horse comes along, eats the grass, migrates from the GI tract through the bloodstream into the lungs, and that's where you end up with adults again. Prepaid period for this, 2 to 3 months to go from infection to the production of new offspring. Now, ocular or periocular nematodes is basically thalassia. Thalassia is in various animals, even people. They live in the conjunctival sac or in the lacrimal duct, okay, in the eye. The adult worm lives there. It passes offspring. The larvae are released. Here comes a housefly or musca anomalius. It takes that larva inside of it. It matures inside the fly to L3 stage. The fly comes back around, gets around the eyes of the animal, and when it does, it deposits more larvae around the eyes, and that's where they live. Okay? All right, now we get to integument nematodes. The first one is the skin worm. Staphylophilarius salci is in ruminants, and in ruminants it usually lives on the ventral midline. That's where you find the houseflies. You can also get the microfilaria there. The intermediate host for this is the horn fly, or Hematoba irritans. The flies are down there. They can be picking up those little larvae or the microfilaria. They move around, and then they get onto another animal and they can deposit those. To diagnose this, because that lives in that skin, you have to either do a skin scraping and find these little microfilaria. And when you do a skin scraping, you got to scrape deep enough to get into the blood vessels, okay, down into the dermis, not just the epidermis. These things can cause summer sores, okay? Summer sores is a thing that we see more commonly with haberdina and rhachia. This is in horses. They live in the stomach, but they cause skin worms. And that's a summer sore on a horse. If I did a skin biopsy, I could find the little microfilaria inside there. Okay? Now, this is the one that's kind of an important one, Onchocerca cervicalis. This worm lives in the nuchal ligament of adult horses. Okay? Could be in the dermis area, deep in the blood vessel area, and that's where you're going to find the microfilaria. The intermediate host for this is the midge, or Culicoides type of thing, and that's that guy. Really tiny little flies, okay? And they fly around and they cause all sorts of problems. These things can cause alopecia in the area, it's irritating. It can cause scaly tissue or scaly skins, and it itches like crazy. And here's the thing about Onchocerca. It could get into the eye area and cause an ophthalmic problem called periodic ophthalmia or moon blindness. Moon blindness, for a long time, they didn't know for sure what was going on. But then they started seeing that Onchocerca was potentially a cause of that. In order to diagnose Onchocerca, you got to do a skin biopsy. Put it in some saline, and then allow those little worms to come out, and then you can start to see them. All right, any question about the nematodes? Okay, now let's get to cestodes. And in cestodes, there's really only two that I'm really concerned about. The primary reason is because they get into people. But we have Monesia, and we have the Tinea species. Tinea saginata and Tinea solium. Different species, but they're both a real problem in people. And then Amplocephala, Peripheral. That's another type of tapeworm. If we look at Monesia, it's usually Monesia expansa. This is primarily in cattle and sheep and goats, or the ruminants. The intermediate host for this tapeworm is your matted mite or a grain mite. Looks like that. These things, the eggs are passed out from the intestine, and that little mite that's crawling around in the hair ingests the egg. Inside the egg, a hexacanth is going to be formed. It's going to mature into the cystocirculate. Then, that mite is going to be ingested by the host, probably from licking at a spot on the skin or something. Once it's ingested, that cystocirculate matures, and then it hatches or becomes a tapeworm. This has a turn-on scolex. That means there's no hooks on the part that attaches to the intestines. The diagnosis is you look for the typical type of Monesia eggs. They're kind of angular, but inside you can see the hexacanth. Okay? Now, beef tapeworms, Tinea saginata. Look at the definitive host on this one. It's people. We're the definitive host. Cow, or the cattle, is the intermediate host. So that means the definitive host has to eat the cow. Okay? And that's exactly what happens. Eggs are passed from people. Where they defecate is going to be out in an area where cows are going to eat. They're going to eat the grass. If somebody's out defecating in the grass or whatever, and they have that tapeworm, they're going to pass it potentially onto the cow. Inside the intermediate host, that egg hatches. The oncosphere gets into the blood, and then it gets into the muscle of the intermediate host. And interestingly, you can actually see it in the beef muscle. That's why they would call it measly beef. Measly beef, if it's eaten by the definitive host, and that larva is still alive, now you're going to get the definitive host being infected with that tapeworm. Diagnosis on this is fecal flotation. Of who? The people. Okay? The cow's not going to have this in their intestines. This is going to be seen on the meat. Now you know why we have meat inspectors. Their job is to find this stuff, so you can see it. If you eat beef rare that has been infected with tinea, you're going to get it. So, key thing is to cook your meat. Fortunately for us in this country, we have meat inspectors. USDA trained inspectors that will go out and they look for this. If they see it, the whole carcass is condemned and it's thrown out. So we have a little advantage there. The third world countries that don't have that option, that's where they see this going. Okay? Then we have Tinea solium. Look who the definitive host is again. It's us. Whereas the pig is generally the intermediate host, even though humans can be the intermediate host. Well, that's weird. So how would the definitive host get it if the human was the intermediate host? You have to eat people. Okay? You got to be a cannibal. But people eat pigs all the time. Okay? We eat pork. This has that indirect life cycle, comes from the human. The egg is passed out, and once it's passed out, it comes out of the probiotic, it hatches, and then the cysticercus forms. And if that gets into the pig, if the pig eats the egg or that cysticercus, now you've got that parasite in the muscles of pigs. And then other tissues that the pig has. The definitive host comes along and eats pig or pork that is not cooked properly. Then it starts all over. It tours into the adult human, or to the adult in the human, and then it attaches to the small intestine. These kind of tapeworms have an armed scolex. That means it's got a really thorny head, so when it perforates into the intestine, it hooks in there. Okay? The diagnosis of this, again, is fecal flotation of the definitive host, not the intermediates. This, again, because of that, is zoonotic. Well, technically, the human gave it to the animal, so that's reverse zoonosis, but then the animal gives it back to the people. So there's your zoonotic aspect. Poorly cooked pork is the way that this happens. Okay? Anoplocephalum are the tapeworms of horses. Okay? It used to be called para-anoplocephala, but right now anoplocephala will work. In this case, the grain mite, that orbatid mite, is the intermediate host again. The egg is passed from the definitive host. Orbatid mite comes along, eats that inside the orbatid mite. Now the hexacanth is going to be released, and it matures into a cysticercoid. Then the mite is going to be eaten by the horse. Once that mite is eaten by the horse, the cysticercoid matures into the full tapeworm. This one has an unarmed scolex. It just has little suckers. Fecal flotation will show you the typical egg, but right there's the hexacanth again. Okay? Really common in tapeworms. Any question about tapeworms in large animals? All right, now let's get into the trematodes, commonly called flukes. And when we're looking at the flukes in large animals, Dicrocelium dendriticum is one of the really important ones, and Fasciola hepatica is the other one. Paramphastoma, yeah, you gotta know a little bit, okay? Dicrocelium dendriticum is the lancet fluke. The definitive host is the ruminant. The intermediate host, the first one, is a terrestrial snail. Then comes along an ant. This one has a really interesting life cycle. The location of this fluke is in the bile ducts, inside the liver. Okay? It's indirect, which means the intermediate host is there. The eggs passed in the bile, through the bile, gets into the intestine, and then it's passed out to feces. Then a snail comes along and eats that egg. Okay? Inside the snail, that egg hatches and forms into a mericidium. The mericidium penetrates into the intestinal wall of the snail, and it becomes a sporocyst. Inside that now, the sporocysts start to multiply. It starts to make more and more sporocysts, a lot of them. And it can multiply enough times to get 100 sporocysts from one that starts. The sporocysts, they form or mature into a cercaria. The cercaria is then passed out of the snail in the slime balls. Okay? Now you've got these slime balls that have the cercaria in it. Now, along comes the ant. The ant comes along and it eats the slime ball. Once it's inside the ant, now it becomes infective. Now it's infective to the definitive host, which is again the ruminant. Okay? But here's what's really interesting. When that cercaria is inside of the ant, it moves up to the brain area of the ant, and it makes their behavior change. And that ant lives pretty normally until it gets close to evening. Then the ant crawls up onto the top of the grass, grabs a hold of the grass with its pincers, and just stays there all night long. And then along comes a cow, eats the grass that has those ants that are hanging onto it, and now the parasite's back in the cow again. Okay? We diagnose this by fecal exams, and this is in zoonotic disease if we eat the ant. Well, there's not many people going around eating ants, but it could happen, especially in third world countries. So, this is the mind control of the ants, and it's really fascinating.
Ants are a part of the most disciplined, dedicated social system on Earth. Until that is, they become slaves to behavior-controlling parasites. Suddenly, these rogue ants no longer serve the colony. They're taking their orders from the parasite. Okay, let's back up. Now, how did this happen? It all begins when the ants in any town, USA, consume the slime of a passing snail. They divide it up and take it back to the colony. This is a blunder of epic proportions. Turns out, the slime is loaded with eggs of a body snatcher called the liver fluke, a type of flatworm. The liver fluke burrows into a part of the ant's brain, and for unknown reasons, it's almost like the fluke enslaves the ants and orders them to carry it to their next hosts. Any grazing mammal host with a nice warm liver will do, but in this case, a cow appears. The liver fluke worms can switch the ant's behavior on and off, causing the infected ants to place themselves in easy-to-eat positions at dusk when mammals are feeding. No cows in sight, ants act normal. Cows appear, ants are in essence ordered to take their positions in purple flowers and latch on. The cows ingest the vegetation, the ants, and the fluke larvae inside the ants all in one bite. Once inside the cow, The worms burrow out of the stomach and into the liver, where they develop into adults and dine on liver tissue. They lay eggs that are excreted from the liver into the bile duct and then defecated by the cows. They don't kill the cows, but the cows become weak and emaciated, devastating herds. And all because of parasitic mind control.
Okay? Pretty interesting when you start looking what these parasites can do. All right, the next is a rumen fluke. The rumen fluke is Paraphastoma or Cotylophora. These are definitive hosts in the ruminant again. The aquatic snail this time is going to be the intermediate host. These guys live in the rumen or reticulum area of the large fermentation vat. Eggs are passed out obviously then in the feces. They hatch in water. Once they hatch, they become a mericidium. The mericidium then swims around and then it penetrates. It can go right through the body of the snail. And it becomes the cercaria there. These cercaria then are going to be able to come out. They're going to insist on the vegetation until the definitive host comes along again and then eats the vegetation. They become an adult in the small intestine and then they move up into the rumen area. Diagnosis of this is looking for these kind of eggs, these operculated trematode eggs, stool or fecal material. Now, fasciola hepatica is another one that's quite important. Definitive host again is the ruminant. Now it's again the aquatic snail is part of it. These live in the liver bile ducts just like Diprocedium did. Indirect life cycle, that means the eggs pass out the feces, they hatch in water, they swim around until they come to a snail. They penetrate into the snail's body, they insist, and then once they come out and are in the water again, it insists on watercress. Watercress, I don't know, have you guys ever eaten it before? It's great stuff. We used to go out and find it in the streams around where I used to live. Unfortunately, we didn't know about this when we did it, but we did wash it really well. But if you ate that watercress, it wasn't cleaned, it didn't have it all off, you could get this, okay? But the definitive host comes along, eats the watercress, it gets into the intestine, gets into the peritoneal cavity. Once it's in the peritoneum, then it can burrow into the liver. These things are pretty good sized flukes, okay? You can see them very easily. Fecal sedimentation is how you do it, not flotation. Sedimentation means that these eggs are really heavy. And so you let them sink to the bottom and you collect the stuff off the bottom. Okay? All right. Now the next one are the acanthocephalans. The thorny-headed pigworm is which one we're talking about now, or Macacanthorhynchus ruminaceus. This, again, is the pig. The pig is the definitive host. Okay, these live in the small intestine. Their intermediate host is the dung beetle. Okay, that dung beetle, once it is ingested, it hatches and becomes a beetle, goes around, and then it's going to be eaten by the pig, either the larva or the beetle form. Once it's eaten by the pig, it's going to mature. And when this thing matures out, these things are kind of large, and they have a really thorny-headed worm that perforates into the intestinal wall and just hangs in there. If a human eats the beetle or the larva, then we could get it. Where would that happen? Usually third world countries, okay? Because they don't have the same hygiene standards. Now we get to the protozoans. The protozoans that you really have to understand are Eimerius, Cryptosporidium, and Sarcocystis neurona. Tritrichomonas and Thalaria, you gotta know a little bit, okay? So first, Eimeria. Eimeria protozoans are coccidias, okay? The definitive host is the ruminant, and they live in the cecum and colon, just like a lot of the coccidia we've already talked about in small animals. The oocysts are passed out in the fecal material and they become infected very quickly. Then the oocyst is ingested. There is no intermediate host necessary for coccidia. Once it's ingested, sporozoites come out of that coccidia and they get into the intestinal cells. Inside the intestinal cells, they start to go through an asexual reproduction, or basically just division. And they create more and more sporozoites. And they get into more and more intestinal cells. And they can go through a lot of different cycles of this asexual reproduction. So a lot of intestinal cells are going to be infected. Eventually, a couple of those cells are going to become macrogametes or microgametes. And they're going to join together. When they join together, we end up with a zygote, and then the cyst wall forms around them, and now you've got more oocysts. Okay? And they can be passing out millions of these things on kind of a cycle. It's not always. So you may not find them all the time on a fecal flotation. But if you find them and there's a whole bunch, that means they're in the active stage right then. This can lead to cryptosporidium, another kind of protozoa. Cryptosporidium, there's lots of species. They live in the small intestines. Inside the small intestines, they have the same kind of life cycle that we talked about with small animal cryptosporidium. So it's essentially the same thing. But now this is going to be in large animals. This can cause a really severe case of scours or diarrhea. And in calves, it can be devastating to the point where all it is diarrhea. Okay? There's tons of these oocysts being ejected. If we happen to ingest the oocyst, now we are going to be infected. Usually it's not that big of a deal, but if a person is immunocompromised, now it becomes a really big deal. Just like it was in small animals. Diagnosis by fecal flotation or a smear that's been stained with some iodine or something so it makes it easier to see. But it has the same basic life cycle. Trichomonas is another one, not quite as common, but this is usually seen in bovine. In the bovine, they live in the prepuce of the male, or in the reproductive tract, the vaginal vault, the cervix, and the uterus of the female. Well, that's kind of interesting. How did they get there? From the male. This is spread by copulation. Okay? The trophozoites are transmitted. Trophozoites, remember, the protozoa that is motile. It moves. Okay? Venereal transmission, once it's transmitted, it goes through binary fission or just simple division, and it becomes more and more. Then, they can actually become a pseudocyst, and it becomes multinucleated. And it stays there as long as it's a stressful condition. Then, once the conditions are better, it kind of excists. You get motile trophozoites again through budding. The problem is, in the bull, in the male, you really can't see anything. It doesn't do much. But we know that in the female, because it's spread by venereal means, in the female it causes lots of problems. Infertility, it can cause embryonic death, and even abortions. Now you don't need that in the beef cattle or in a dairy cow. So they do everything they can to prevent this from happening. Diagnosis, they actually look at gastric fluid from an aborted calf. You can find these things just kind of swimming around in there. Uterine discharge from a cow that may have been infected by the bull. But the other way is you do a preputial wash on the bull. You put him in a set of stocks, you go in there with some saline, and you wash the inside of the prepuce out and collect the fluid. And then look at that other and see if you can find that funny little one-eyed undulating protozoa. Pyroplasmosis is another protozoa. Pyroplasmosis is something that is passed by ticks, okay? Usually we're looking at filaria or babesia. In this case, the horse is the definitive. The intermediate, or excuse me, where they live is intracellular in red blood cells. These things, the sporozoite is injected into the animal, and it affects the red blood cells or pre-red blood cells, except for babesia. They go through asexual reproduction and they form merozoites. Then that mononuclear cell ruptures, okay? Once that cell ruptures, then that merozoite can get out and get into red blood cells. Once it's in the red blood cells, it goes through reproduction, and you can start seeing these funny looking little bi-winged organisms that live inside the red blood cells. Once that happens, they continue reproduction. They continue that replication. Once they've gone through enough, then they form what's called the gamete. The gamete is a ring state. It looks kind of like that, but now it forms a ring. It looks like a signet ring. Then, along comes a tick. It ingests blood, and inside that blood is the gamete, or that ring stage. Once they are inside there, they fuse and become zygotes, and then a kinete. Once that happens, they get into the salivary gland of the tick, and then they mature a little bit more. Tick comes along and bites a horse, and then it passes it on again. The problem with these kind of organisms is it can cause peracute or very, very quick disease processes. Or it can be acute or subacute to even chronic. It depends on what kind of an infection they have. Clinical signs, if we've got abnormal things inside blood cells, the body knows how to get rid of that, right? Through the spleen. If it's abnormal, it's going to be taken out. Blood cells can start to break apart. That can cause intravascular hemolysis. That can lead to severe anemia, with all of the signs that go along with anemia. It can cause problems with platelets. It can cause fever, edema, and then even sudden death, okay, if it's a really bad infection. In this case, you have to diagnose it by a blood smear. You do a blood smear and you see those little organisms. If you look here, we have the babesia organisms in there. And if you look close enough, you'd probably find it out. Okay? Or, because it's in the blood, that means there's going to be an antibody response to this antigen. And so you could do serology and find pyroplasmosis. Now, another protozoa is Sarcocystis. Sarcocystis neurona is the one to be aware of. In this case, the definitive host is the possum. Well, that's weird, because how many possums do you see around here? You don't, unless it's a pet or in a zoo, because they don't live normally in this area. However, there's lots of different animals that can be the intermediate host. If it gets into a horse, the horse becomes a dead-end host. Okay? It's not necessarily an intermediate. The thing about Sarcocystis is it lives in the nervous system, especially the asexual stage. It has an indirect life cycle, so that means the possum is going to be the definitive. It passes out the oocysts in the fecal material. Then, whatever intermediate host comes along, eats the oocyst. Inside that intermediate host, it goes through those cycles. It becomes the merozoites and creates more and more and more. And then we end up with the resting stage. And that resting stage is called the sarcocyst. Now, along comes the definitive host. It eats the sarcocyst, whatever it was, the intermediate host. Once there, that sarcocyst exists and it becomes a brazoid. Now we've got the sexual cycle in the definitive host, and they're going to produce the oocytes again. If a horse ingests those intermediate, or the choriolated oocysts, this gets into the central nervous system. And in central nervous system, of course, it really screws them up. They can get just very neurological, not to the point of seizures or anything, but they can't walk straight, they may not see very well. But that's the problem in horses, because it gets into the brain. So they get ataxia, they start losing weight, they start having muscle twitches, they're weak, their cranial nerves may not work. And if you look really closely at this horse that's infected, what do you see? Really severe muscle wasting on that one side. And it can be specific to certain types of muscles, okay? Diagnosis on this is basically through a neurologic exam with a horse, and then doing serology, because it can get into the bloodstream. All right, any questions on large animal internal parasites? Okay, now don't forget that a lot of these are very similar to the small animal internal parasites. So don't get so wrapped up that you can't recognize the similarities, and use that to learn one. You can know about it, 3. Okay?